Chief of DevX, back again with one of these video conversations I've been doing with leaders in our community, and really delighted to have Sam Worthington to join us today for this discussion. Sam, really good to see you. Good to see the beard. I can see something different about you, but people know you well. They know your name, if not your face, in our community for your leadership in the international NGO community for a long time now, and the last 10 years as the CEO of Interaction, which is, of course, the alliance of pretty much all the international NGOs in the US. It's a big alliance. You're very much kind of have your finger on the pulse of what international NGOs are going through, what they're feeling. And so I wanted to get a chance to sit with you today just to hear your take on this whole situation and what you think it's going to mean for the international NGO community. Lots of implications, obviously, in terms of the work, operations, fundraising. So lots for us to talk about. But maybe just to start, how's everything going for you? How are you seeing the situation as it unfolds right now?
Well, thank you, Raj, and thank you for this opportunity to talk with you all. I think, I guess my beard is a good statement, is that we are existing in a sort of parallel reality here, which has now become the one that we have accepted as norms. And particularly for those of us who spent some time in the humanitarian community, we tend to go to some place for a disaster. Rarely are you in a situation where your home is also experiencing a crisis. And you're living that crisis in your daily lives, just as at the same time we're trying to respond and figure out how to prepare for a global response as this pandemic spreads to some of the poor parts of the earth.
And that's your expectation, right? I mean, I've been talking to lots of global health leaders, epidemiologists, that look, this could hit a lot of the countries in the world that today have very low numbers, comparatively Africa, for example, very low numbers.
Well, I started my career with HIV/AIDS in Africa, so I have a sense of what a pandemic does, and you have a village with 40% of the adults who are dead back then. And if you recall, there was a time, and it was maybe 2 weeks before we started shutting down and going home, where the numbers were low. And it hadn't taken off. And the reality is you don't have the same testing capacity. You don't have the same ability to trace things. There is no CDC scale infrastructure. And as much as our response had its flaws, whether you're in Brazil or seeing in parts of Africa, other places, this will eventually take off. How it will take off, the magnitude, we don't know. But it's a disease that will, until there's either some herd immunity or a vaccine for all people, it will begin to continue to ravage the world. And our fear is that in June and July, we're working closely with the UN on this, we're going to start seeing some significant numbers in Africa and other poor places.
So now, just for folks who may not be as familiar with Interaction, you're an alliance of all the big international NGO groups like Plan that you used to run, Save the Children, Mercy Corps, CARE, Oxfam, right? The international NGOs writ large. And so when you talk to the leaders of those NGOs, they're probably scrambling to do exactly what you described, deal with their home staff here in the US who are facing this challenge of working from home, or maybe some of them have been affected or their families affected by the disease, and at the same time respond in countries where the numbers might be low today, but we think they could be growing, and at the same time keep all their existing programs running because they're working on so many other important issues.
Right.
So how are they doing with that right now, and how do you think it's going?
Well, I think that, a sense of overwhelmed in some ways, but they're being pulled in multiple different directions. If you have a large, say, education program or microfinance program operating in the world, and your staff are in a country with some form of lockdown, how do you deliver? Your ability to function on regular programs is significantly harmed. At the same time, you have this question of access. If you can't move to field programs, and you're stuck in the capital, how do you visit the communities within which you're operating? And then you put the overlay of COVID on top of this. And as COVID comes in and the disease spreads and has a greater impact, you have to think of this as sort of multiple waves of different impacts at the same time. So we tend to think of the disease and then move to the economic. But if you need to step back and look at the broad socioeconomic impact of this, individuals in slums can't get access to the resources they need to survive the next day. You begin to have an increase of hunger and the anger that causes in urban environments. You end up having governments continuing to crack down on civic groups and trying to exert control over society. All of this is happening in different degrees in different contexts. And the NGOs, which are deeply embedded around the world, we figure there's a good 130,000 staff operating in these different contexts, are trying to prepare and at the same time deliver programs. You're preparing for when the numbers start to rise significantly. The health NGOs have significant experience in working with Ebola. Others are setting up to help the government, or where there isn't a government infrastructure, to have their own. We work very closely with the Office of Coordination of Humanitarian Affairs in the UN,
UNOCHA,
setting up that infrastructure, because one of the first questions will be, if we're sending significant numbers of humanitarian staff into areas that are at risk, let's say you've got a takeoff of coronavirus and COVID into the Cox's Bazar, where I was last December, 900 plus thousand people in quite close quarters. Sending staff in there and your staff member gets sick, where do they go? So we've been working with the UN to set up field hospitals around the world, 7 different field hospitals, for the ability of aid workers to retreat when they're at risk. And then lots of debates.
Are those set up? I'm just curious.
2 of them are underway in Africa. So we've got approvals to move 2 of them. They're sort of Norwegian facilities. WFP, the World Food Program, is setting these up. And then you have the question of logistics. So the ability to get in and out of the DRC today, you can't do that on a commercial flight. You're going to need to do it through a UN flight out of Geneva or some other place. So this ability to move people, the ability to move logistics, the ability to have your staff treated if they're sick, and then this agreement with governments on access for health workers and humanitarian workers. There aren't, this I was mentioning, ability to move to a place where there's need. You need a government that will enable you to have a convoy or individuals move into an area where there's an outbreak. All of this is being negotiated at this point in time before there is the significant takeoff of the disease in the global south.
Right. I was talking to Jan Egeland on one of these video interviews recently, and he was describing an air bridge that the UN was trying to set up. Obviously, he's the Secretary General of the Norwegian Refugee Council and was the head of UNOCHA. So there's a lot of activities happening in the background here to create that access. It's got to be tough, right? I mean, there's a tough challenge between deciding whether aid workers should just stay home and shelter in place, or it's time to kind of get out and get to the field and do the job they do. Of course, aid workers take risks all the time, but how do you weigh this? As you advise some of your members about when to think about deploying people, who to deploy, who's really essential. Of course, you might lean toward using more professionals in the countries where these disasters are taking place rather than sending in international experts. How do you think about it?
So I was mentioning there's 130,000 sort of staff around the world, and about 8,000 of them are expats. And the question to some extent was less deploying, but more, do they come home? So I was talking to one of our major members, and they have hundreds of staff scattered across Africa. And the question, do you come back to the US or Europe or wherever your home is? And the vast majority decided to stay, which means they're there with the health infrastructure that you're living with in Uganda or whatever the country you're in. And you are now responsible for hundreds of staff living in environments where they will not have the same degree of treatment they have here. For humanitarian organizations, I wouldn't say it's easier, but there is sort of an agreement that I'm in this business to do this, and I'm willing to take a risk with my staff, and they have signed up for this. What I'm seeing is this sort of merging of the humanitarian development nexus. For development organizations, all of a sudden they're confronting the risk profiles and the risk calculus that have to happen in humanitarian organizations with staff who have not signed up for that type of operations. So, some have sort of frozen and moved to do nothing. I don't want to be a vector, let me not do anything. But at some point you will have to decide, am I or am I not engaging? And it may not be a response directly to COVID, but if you have the ability to do wash programs and hand washing programs in a slum, you will begin to engage, and your staff in those circumstances will have the same risk as any frontline worker operating here in the United States.
That's right. And I think there's also a spectrum, even among aid workers, even people who've signed up to do humanitarian work, in terms of what kinds of operating environments they're
Right.
willing to go to, what the risk profile is. Obviously, going to a place like Syria or Yemen versus a place that you might have significant challenges, but it's not the same level of kind of active conflict. And now that could change because of the potential for social disruption. How do you read that? I mean, if we have food crises, as you mentioned, countries that previously seemed quite stable may no longer be. And you might have been there for a 3 to 5 year assignment working on a development project, and suddenly where you are, the risk profile has just changed quite a bit for you and maybe your family.
And this is where we can't just think of this as a health crisis, because if we're thinking 500 million people moving back into extreme poverty, individuals who were able to just feed themselves now hungry. And as given the urban migration we've seen, hunger isn't in their hinterlands anymore. Hunger will be in cities, and hungry people in cities will take to the streets. There'll be riots and so forth. So the risk is the economic impact of this can result in this significant destabilization. And in response, regimes are in some ways, or governments doing the wrong thing, which is further cracking down in their response. So it means that the crisis has come to you rather than you're going to the crisis. An individual's ability to respond in those environments will vary tremendously. I think organizations need to be very sensitive to the fact that some will not be able to perform the way they have. That we need to adopt some of the duty of care norms that the humanitarian community has done within the development community. But it requires a rethinking of a number of protocols. And this really also impacts the donors, because we've worked in an environment where donors, you deliver and they're supposed to be results and so forth. At this point in time, the result that we're looking for is the maintaining of the capacity of the NGO sector and not dismantling it because your programs can't be implemented, or you're preparing for a greater engagement. So we need a much more flexibility from all donors in their willingness to help work with the NGOs as they adapt.
Are we getting that? Do you see the donors moving at this point to be flexible?
Yes, I'd praise AID on this. I'd praise the philanthropic sector, particularly moving in this direction. I think one of the challenges behind this is the backbone of the US NGO community has always been the person giving $100. 24% of the $15.4 billion going through Interaction members is US government. The rest is a whole mixture of other types of resources. And as small donors pull back, and we saw this in 2008-9, and I'd counted over 10,000 staff lost, NGO staff lost during that downturn. As those donors pull back and give less, that is the most flexible resources that NGOs have.
Yep.
So they'll become increasingly dependent on UN, US government, EU, other monies. And we need the flexibility of those resources to ensure that they can respond effectively.
Yeah, I mean, just to put a pin on that, essentially NGOs are dealing with a lot of restrictions in the money that they take, right? And the way it has to be spent for certain programs, certain geographies. Whereas lots of individuals, when they give $25, they write a relatively small check. It's an open check that the NGO can use it for whatever they need it for. That money shrinks as a proportion of your total budget, and suddenly you've got problems because there are things that you just don't have money you can spend on that you really need for your operations, maybe even like IT infrastructure, for example. And I imagine at a time like this, when NGOs are trying to change the way they operate, flexible money might even be more important than ever.
So you're starting with a program is supposed to be an education program. That's why it's set up. You do need to get in the community, and you notice that there's the need for some water and sanitation and hand washing facilities in that community. Do you have the capacity to pivot and take what was supposed to be an education program and expand, you could link it to education, expand a program of education around WASH and change the norms of your deliverables under that project? Because you see that the biggest gap, given the impact of COVID, is something that was not planned in the original grant.
So you gave some praise to USAID. What do you see them doing at this point in terms of flexibility for NGOs?
Well, I think with the OMB guidelines enabling nonprofits, or I mean, enabling U.S. governments to sort of step back on the deliverables, we're seeing aid sort of asking the question of what do you need, how do you adapt your program, rather, you're basically taking a field-centered approach to the delivery. They're pushing resources out. There's not as much out there on the front lines and so forth. There are areas where aid's been flexible. There's one area where we have a challenge with the U.S. government, and this is in their personal protective equipment area.
Right, they're not allowing U.S. government funds to be used to purchase PPE that goes overseas, right? Is that the basic gist of the rule?
Well, yes, and it's not just go overseas. You're not taking equipment here from the United States, which would make no sense. You want to have as much protective equipment here in the U.S. But if you're operating in Malawi or Afghanistan or Syria, you need to be able to buy face masks and gloves in those environments, and from local markets or regional markets. So you're not competing with the U.S. And so in any ways, you're hindering. In an NGO, you have this choice of, do I go out or do I not go out because I need a couple 100,000 protective equipment for my local staff. And our situation is we have a direct responsibility for our staff and their safety. So you cannot expect the same type of programs happening if these equipments are not available.
Are you in active negotiations with USAID about that issue? I mean, that seems like probably a White House driven or higher level question. Where do you think that's going?
We're engaged with the leadership of AID on this, and I think they're trying to get clarity as to what the flexibilities are at this point.
Yeah, because that could become a situation where those individual donor funds become even more important if you have to use them for things like purchasing PPE in order to supplement U.S. government programs that don't let you.
Right. And this depends on, for the organization with lots of different funding types, that works. For some that are more dependent on the U.S. government, much harder to do. So again, hurdles like this make it more difficult to implement programs at a time when we actually need the greatest possible flexibility to respond.
Yeah, in some ways, the really big international NGOs that have a more of a public brand, they do get that individual contribution flow, which is very valuable to them. It's unrestricted, as we described, but they're going to see a downturn in that. Likely, maybe they already are seeing that downturn. I don't know. Have you heard that anecdotally?
Well, I've talked to good 30 plus CEOs in the last few weeks. Some are seeing a downturn already. If you have you could use Oxfam as an example. If you have all these shops across Europe to do things, you'll have problems. If you're CRS and your big fundraising is around Easter in churches, you're not going to see that money coming in. So you're seeing some downturn. The worry is that we tend to be a lagging indicator. So it tends to be last 4 months of this year, and then into 2021, where you're looking at good 15% decline of the overall resource base of NGOs going in. Could have significant impact. Quite a few organizations have applied to the PPP program to sort of make sure that we're not laying off staff. But that deals with the short term, and I think stabilization. Our worry will be the degree to which there's significant funding coming in 2021, when some of the fiscal realities of this big investment start hitting. So I'm concerned that there's going to be a very difficult time for the sector in the year that comes.
Yeah, I know there's been a call from a group of NGOs to fund a $60 billion kind of rescue effort for the sector here in the U.S., looking at things like taking the tax credit, the charitable contribution, and making that universal instead of having a limit. How do you see this issue? Is the government, are you getting traction in terms of the U.S. Congress in seeing the NGO sector as a sector, maybe a little less directly hit in some cases than restaurants and hotels and travel, but pretty close to the front lines in terms of being hit, given that discretionary money that people can provide, given that there are many shops, many retail operations directly tied to not-for-profits? How are you doing in terms of making that political argument on the Hill?
So we've been actively engaged with the independent sector on this and some of the others. And one thing to remember that our members we think of them as global brands engaging. They actually spend a third of their resources here in the United States in poor communities. So they're actively engaged in the US. Some are actually bringing experience, International Medical Corps bringing experience from Ebola to hospitals in LA to help the LA hospital system scale up and respond. But Congress has been responsive to the idea of we've pushed for a $12 billion investment in the international engagement side of this, health, the international organizations, debt relief. They've been responsive to on the debt relief side, as has the Treasury. We've also included in that, at least for the international ones, a push for some $400 or $500 million for support of the NGO structure. As I'd mentioned, this 10,000 job downturn, you have this question of, do you get rid of these jobs? And if you think of that in the context of the US, a lot of these organizations are frontline responders in terms of access to food and food banks, the ability to people who are not mobile getting to hospitals and so forth. We've built this massive infrastructure of 1.6 million nonprofits in the US that are, in essence, known by their church names or local or mosque or other names that respond to people. And that infrastructure is dependent on grants. Resources flow through them, but as their biggest side of them is general contributions from the American public. And as the American public themselves feel the squeeze economically and are concerned, they will pull back just at the time that these nonprofits need the most support. So encouragement on the question of, can you get better tax deductions on this? The first one went in with a $300, sort of exemption there, much too low. We were pushing for, $4,000 to $8,000, depending on couple or individual, or in terms of charitable exemptions. But we have to think of this in terms of the maintaining of a sector. And one can think of a bailout of the airline industries. We're not looking for bailout. We are looking for the ability to maintain the infrastructure, both front lines here in the US and front lines overseas, that will ensure that nonprofits are able to do the types of service they need to do. And that goes beyond simply the individual grants that flow through them.
Yeah, people typically think of it as an industry, but in many ways it is an industry and an essential one. And making that case is important. One of the trends that I hear about, and I just want to get your take on whether this is real, whether you're seeing it, is that in the end, especially the international NGOs, those do a lot of work overseas, the big ones are going to be okay. They either have some money in the bank, some kind of an endowment, they have multiple funding flows, including individuals, and they've got the scale so that the big philanthropies, the USAIDs and the DFIDs and others, will want to turn to them and say, we need you because we got to act fast. You've got the scale and ability to go do work for us quickly. You've got footprint around the world. And maybe you already have an existing project portfolio with us that we can just, turn it and pivot it toward the COVID response. And the groups that will be hit hardest are the kind of mid-tier NGOs, international NGOs. It might be $50 million in annual budget. It doesn't sound too small for many much smaller NGOs, but still it's not quite big enough to have that scale to be attractive to the international funders, to have the project portfolio in place that you can just pivot, and that those could be at real risk, and that we may see as a result a lot of merger and acquisition activity within the NGO space. What's your take on that? What are you seeing so far?
Well, this has been a long coming trend that we're seeing, and the big brands, again, as of Plan International and are the ones with infrastructure. Your $1 billion entity operating in 70 countries, your infrastructure is entirely local. I think one of the challenges that the mid-sized ones and others face, and this is accelerating with COVID, is the localization of the response, is that the ability to respond is dependent on your local infrastructure. And that local infrastructure may be partners with local nonprofits or civil society organizations, or it may be your own staff in country. So the ability to maintain that local infrastructure, which has a cost to it and so forth. The big ones are able to maintain it by investing and keeping resources. Very small local ones this is what they only focus on. The mid-sized ones have more difficulty doing that. And my worry is that we're going to end up with sort of hollowing out of the middle of the sector in a sense. Yes, mergers help and so forth and get scale. At the same time, having spent my career in a very large NGOs, I think one has to recognize the mid-sized ones are oftentimes more agile, able to respond in new ways. They bring in new ideas. So, I hesitate in saying that simply large is good, but it is where the market is pushing things in this sense. The irony about this COVID situation is that the area that everyone wanted was the type of resources were lots of small donations that allowed you to have the flexibility you want. And ironically, that's the area that is actually being hit the most and will likely be hit the most in a sense. So it's going to push nonprofits closer to donors, which I worry a bit about in terms of our own independence. It will accentuate the power of the local, which I think is a positive development, and it requires this sort of evolution of how we engage with local actors in terms of responding. And it will give some credence, and this gets to the mid-sized group, to those of significant technical expertise. If you really are, knowledgeable in the health sector, or an ability to move individuals in complex environments as a humanitarian organization, you're going to have an advantage over an entity that is a broader brace development nonprofit that may not have that type of capacity.
Yeah, it seems like the niche players, if you've got a niche that is really in demand, you'll do well in this environment, even if you're small. But it's the ones, exactly as you say, that kind of do a little bit of everything, but still don't have the scale, that might face this challenge of needing to merge or acquire,
Right.
or become part of some other group. How does that actually happen? I mean, you talk to NGO boards,
Right.
there's very little activity actually in normal times. We've seen a little bit of an uptick maybe in the last several years, but often it's is kind of a state of weakness. A nonprofit's not doing well, and they're kind of forced into this. What are you hearing the conversation like now
Right.
at the board levels?
I mean, we had a retreat in January. We had 76 CEOs and so forth, and and something I was sort of tracking over the past year, which is now public, the merger of Global Communities and PCI. And in that case, actually, two organizations with solid portfolios and the resources to do this, and approaching it from a scale desire, even though they were both in strong positions. And what we've had is lots of CEO conversations around this, not to push mergers for the sake of mergers, but to ask the question of how are you going to be relevant 10, 20 years down the road? How do you position yourselves as an organization going forward? I'm finding a lot of executives are talking to their boards about this, but the boards aren't there yet. There isn't the knowledge of the sector that necessarily needs to be there, an understanding of some of the pressures. And then by definition, there's sort of this appeal of your own brand. This is why you join, you care about them and the niche that you do. And by definition, as a nonprofit, you save lives or help lives in a way that's meaningful. And we've been challenging boards and others to be more strategic, is where do you add value here? If local capacity is significant, what value do you have that's beyond the local nonprofit? Is it fundraising in a certain niche? Is it technical expertise? Is it scale that you're looking at? So asking these questions of how ultimately adaptable your organization is, and that your leadership needs to be sort of adaptive and responding not just to shocks, but trying to get ahead of those shocks. That's the type of conversation we're seeing within the sector. But it is, I think we're entering a period where those shocks are going to be much stronger, more severe. And what you don't want, which is unfortunately we may see, is organizations trying to merge or trying to find a way out when it's too late and they're too weak. And it does take time. I know the PCI Global Communities merger, that was a year plus conversation in the making before it became public. There were dozens of different options considered as they went in. And then you get the sort of timeline on going on the out end, which CEO is in place for how long and shifting. These are complex things, and they do need to involve the board right from the beginning, or you will get, it'll be derailed down the road. So you need both good leaders in the respective organizations and willing boards to move this forward, oftentimes in a difficult environment.
And when times are good, NGO mergers are tough, because often the argument behind a merger, the kind of synergy that you might get, includes layoffs. It includes, reducing some of your overhead costs. It might include reducing the combined scale of the executive team. So executives might be kind of disincented to do it. Boards feel that personal attraction to the brand, the mission. They've been part of it for a long time. They're donors often to the organization. So the last thing they want to do is sort of see their brand that they've invested in go away. So you're right, it's tough in normal times, but then you get to a situation like this, and boy, we might see nonprofits going out of business, right? In numbers that we haven't seen before. If you look at the charts versus 2008, 2009, the Great Recession, I mean, this looks like it could be far worse from an economic standpoint here in the US. Are you expecting that we will see a number of casualties in the NGO sector?
I mean, we've always have a churn on the lower end, and that's just come and go of smaller ones. There's great new ones that start up, some get more scale, others don't make it and go. So in our lower end of members, that's been a reality. Even over the last 5 years, we've been noticing more on the lower to mid-size, sort of the under 20 million, much more sort of worried about economic pressures and tightening down on that end. And then, as you mentioned, now sort of working up into the 50 million. I've always viewed this as if you're in the right niche at the right time, you could boom. Microfinance boomed nicely at one point. Nutrition did at some point. The challenge is when your niche is no longer the one that the world is paying attention to, and that then you end up significantly shrinking. And the challenge then is these mergers require not just sophistication of pulling off the mergers and partnering with outside actors on this, but the right mix of organizations and resources. If you have a complete overlap of country offices and so forth, you could do this solely for a tightening of back-end offices, but it's going to be a very difficult merger. Much easier for the case of the PCI and Global Communities, for example, where they had less than a dozen countries overlap. And the vast majority of their programs in countries where the other was not operating, so you end up with a significant increase, where you had a significant complementarity of the types of programs that operated, and you had enough untied resources within the mix to fund things and move it forward with a vision to do that. To shop around to find that type of mix is not easy, and to do it when you're being squeezed even further and others may not find you appealing, the risk really comes down to cash flow. If you don't have the cash flow to pay your staff, at some point you're confronted with this very tough question of, you lay off staff for a particular grant, you don't get the overhead that you need to maintain your back end, you shrink your back end, and you continue going down. And if you play that wrong, not only do you shrink, but you reach a point where it's not tenable and you'll have to go out of business.
Let's talk about layoffs for a second. I mean, we've got a survey coming out at DevEx. Results will be released tomorrow, but let's just say they show some pretty stark figures in terms of concerns in our community about layoffs. I've heard some of the international NGOs that do have retail operations, they've been in that position of doing layoffs or furloughs. What are you hearing at this point about salary cuts, layoffs, furloughs, any of those kinds of measures on part of your members?
It's still early in the sense because of the COVID crisis, but early, I'm, again, talking across members internationally, 3,000 or so furloughed layoff staff that I'm aware of at this point in time. It will accelerate this fall as that unfolds. The numbers that are successful in getting the PPP program has been quite positive. Again, those are organizations under 500. Actually, some of the international ones fall into that because their U.S. entity is separate from the U.S. legally, from the international part legally. So you're seeing a sort of getting ready for this, a tightening of budgets and belts, but it's still a couple months off, where it tend to be a lagging indicator. And so the challenge is when you see it coming and you look at the economic environment, and one of our members had actually done a mapping of the impact of 2008, 2009 on their giving and their staff. And they're mapping that back into this period to see what it will look. And they're, again, you're talking hundreds of nonprofit staff being laid off in that period. Unless there is some form of government intervention and support of the infrastructure or others willing to pay for the time, because the demand for services is going to go through the roof. And this is what our biggest concern. I've raised this with heads of UN agencies, leadership at AID and others. At the time when we will be experiencing the most significant sort of fiscal constraints on our ability to function. And this will be accelerated further with local nonprofits here in the US or local nonprofits around the world, where you're most needed, you will be actually confronting the risk of actually closing shop or pulling back. And this is where we need a partnership with the US, UN, or other actors to step in and ensure this infrastructure stays in place.
What's your advice, if any, to people working in the nonprofit sector, international NGOs? I'm thinking especially with some of the younger people beginning earlier in their careers, maybe they're most vulnerable to layoffs. I mean, this is a tough moment because you'd imagine if it hits the sector, it's going to kind of hit much of the sector at the same time. So you get laid off and it's not obvious what the next step is. How do you think about this? I don't know, maybe drawing on what you saw during '08 and '09.
I mean, the way, personalize it, I have 3 kids, all in their, 20s, 30s, all couples. 2 out of 3 were laid off, during 1 week. One in the nonprofit sector, another one in the Broadway theater sector. I think our challenge for younger professionals is what you described of layoffs and not knowing what is next or what sector is safe is going to be work in general. It will be across all sectors, and we are in this mix. We're in some ways a little more stable in the sense that your partnership with governments and others is well-founded and deep. So the sector will still be here. There'll still be significant resources flowing through it. In some ways, you're getting, a willingness of organizations to cut salaries over a certain amount. They're doing what they can to maintain the sector. It's not as safe as it perhaps would have been, but it will be in many ways safer than perhaps other sectors you might go into. But this is a reality, an economic reality that I think we have to deal with. And it raises the question for the nation state, in this case, the US government, to what extent do you want to maintain these infrastructures? Or what extent are they a public good that you need in the United States or overseas? And if they are a public good, that is for the good of us, because as the disease spreads around the world, no wall or barrier or ban of flights, it's going to come back at us. It's a global pandemic, and that global part of it means that unless we deal with it everywhere, we will still be confronting it for years to come here in the United States. And that means investing in types of infrastructure that can combat it as early and as long as possible.
That message, resonates a lot with our community. I'm hearing a lot of it internally, let's say, in the development community, but not a lot of it externally. I mean, it seems like the narrative is still very local, your community, your state, your city level, and of course, nationally. We got Debbie Birx in this incredibly powerful role, and she obviously knows better than anybody how important it is to have strong health systems everywhere in the world. What are you thinking in terms of the leadership that's required to get the world to pick up the message you just laid out there, that this is global, that we do have to care about it everywhere? Because it doesn't quite yet feel, to me at least, that narrative is being picked up.
And our challenge is we have to say 2 things. It's global, but it is fundamentally local. So it starts where you are. It starts with your community. It starts with your ability to go outside and put a mask on and how safe you are and buying your groceries and so forth, or going back to work or not going back to work. It starts with the local. But over time, your safety at that local level will depend on the degree to which we deal with other locals in other countries around the world. It's global in the sense that it's linking all these local experiences around the world. And if it's a focus of our community versus some other community, and we will survive and they will not survive, or we have done good and they have done bad, that creates a dynamic where you're not recognizing or supporting the idea that you have to deal with this all together. So the leadership is about, yes, being local and recognizing that local, but taking the next step, and particularly as it shifts away from us, as we flatten the curve here and move to an environment where you're seeing a takeoff in other countries around the world. If we forget for a moment that takeoff of the disease in other countries is going to not impact us locally again this fall or next year, we've taken our eye off the ball. So yes, start local, but remember that the solution is beyond us and requires other countries, and particularly in the world's poorest places, and attention to their needs.
I just want to shout out and recognize people who are submitting questions. I've been trying to weave them into our discussion. There is one I want to get to that requires me to jump a little bit, and that is around the mid-sized NGOs we were talking about, and kind of the challenges they may face. One of the things we've heard is that USAID is waiving some of the small business set-asides. Is there an active conversation underway about the impact this will have on those smaller and mid-sized NGOs, given the importance that you stated they have, in terms of USAID actually proactively doing something to ensure that they stay in business and that they get the funding that they need and can do the work that they do?
We're not there yet. We've been negotiating, sort of back on NICRA rates upon this. It's sort of being left to sort of individual program officer, in negotiating specific grants, cooperative agreements, and so forth, and norms around that. We've been stepping back and engaging at more of a leadership level and going, can you make this an agreement across all entities? Look at this as a sector, not as individual agreements for this. They're not there yet. I think at this point in time, aid has a transition leadership. You have an administration that's also in transition, looking towards the elections. We need to get to the point where there is a discussion, a deep discussion of, aid talks about implementing partners, but let's focus on the partner of that. If you don't have those partners and you don't maintain the broad diversity that any administration wants, whichever government, whichever party is in power, you want that diversity of different actors engaging with you at a time when the middle is squeezed, when a lot of expertise is at risk of being squeezed out. You have to decide whether or not to invest in this. So our push is invest in it, allow higher NICRA rates, allow individual grants to fund staff that may not be significantly delivering at this point in time. Look at the midterm here and recognize that you're trying to maintain your ability to respond at that point.
And when you say higher NICRA rates, you mean allow basically higher overheads to be
basically,
reimbursed?
yeah, NICRA, sorry about the higher overhead rates. So if your staff can't deliver, put them on overhead for a period of time and allow that infrastructure to maintain itself, even if they aren't delivering the types of programs you're there,
right.
And have the US government pay for that. The goal being that 6 months from now, you are then delivering programs with capacity that you would have lost otherwise.
Yeah, absolutely. Now, we've got limited time left here. I wonder what your advice would be to international NGO executives. Let's say you're the CEO of an NGO. You're obviously dealing with this immediate crisis. You're thinking about donations and your staff and actually executing your work. But as you described, this is a long-term shift, potentially a long-term pandemic. What are you reading as kind of the long-term trends that will come out of this that NGOs are going to need to start grappling with about how this is going to really affect their work for the future?
Well, I think part of it is if this is not a technical fix. It's not doing the things you've done and more of them is not going to resolve this. It really is an adaptive thing. It's the ability for you to step back and think with your board strategically, where do you want to position yourself X years from now? And where do you add value? And what's your relationship with local actors? What's your technical expertise and so forth? But to do that, you need some space from the day to day. And that's very hard to say in the midst of a crisis, but actually asking people to step back from the crisis, look a little bit over the horizon, take a day, a month, or whatever time of month you need to do this, and ask yourself the question of where will you be relevant and why, not in terms of the next grant you might win and so forth, but in terms of the landscape that you understand around you and the type of impact you want to have. The organizations that are the most adaptive, the most flexible ones will be the ones ultimately that will thrive long term.
Yeah, that's interesting. It's really about adaptability more than any kind of set asset or infrastructure you might have. It's that cultural sense of being able to roll with punches and changes that we can't really anticipate right now.
Which is hard to do because the punches are going to be tough and our instincts are to pull back and deal with the crisis in front of us. But one thing that we've learned in any crisis management, yes, deal with the crisis, the systems around us, but have your eye on the horizon of where will you be 2 years from now. At this point in time, I think a lot of executives don't know exactly what that will look like. They do know that it will depend a lot on the nature of their partnership with donors.
Well, this has been a fascinating discussion. I know you provide a lot of really valuable insights from the unique perch that you've got, Sam, as the CEO of Interaction. Thank you for all the great work that you and your colleagues are doing from all over now, probably the Interaction team. I know the community really appreciates it. And thank you for taking time to be with us today.
Well, thank you, Raj, and thank you for the chance to talk with you all. Appreciate it.